LHV student lecture on vestibule. Vestibule is actually a triangular space bounded interiorly by the clitoris, posteriorly by the foresheet, and laterally on each side by the labia minora. Okay, there are the four openings in the vestibule: urethral opening, vaginal orifice, and hymen, and two opening into the Bartholin ducts. You can see the vestibule. Vestibule is present here. This is the vestibule. Urethral and vaginal opening are present on the vestibule. And in the anatomy of vestibule, you can see the vaginal orifice and external urethral orifice. This is the external urethral orifice and there is vaginal orifice. The vestibule is limited on each side by the labial fold and leads to the vagina. There are four openings of vestibules. Urethral opening. It is situated in the middle line just in front of the vaginal orifice, about 1 to 1.5 cm below the pubic arch. It consists of paraurethral duct. These ducts either open into the posterior wall of urethral orifice or directly into the vestibule. Second one is vaginal orifice and hymen. Vaginal orifice or hymen. The vaginal orifice lies in the posterior end of the vestibule and it is of varying size and shape. In virgins and nulliparous women, the opening is closed by the labia minora, but in multiparous, it is exposed. Let's talk about hymen. The vaginal orifice is incompletely closed by the septum of mucous membrane called hymen. The membrane varies in shape, but it is usually circular or crescent in the virgins. During the childbirth, the hymen is usually lacerated. Let's talk about opening of Bartholin cyst. There are two Bartholin glands on each side. On each side of the vulvar surface, there is two Bartholin glands are present. There are two Bartholin. The round one is Bartholin gland. Pea size के होते हैं. Bartholin ducts are yellowish white in color. The location is they are situated in the superficial perineal pouch close to the posterior end of the vestibule bulb. During sexual excitement, it secretes abundant alkaline mucus which help in lubrication. The duct is lined by columnar epithelium, whereas whenever we discuss about secretion, you must keep into your mind that secretion is usually associated with the columnar epithelium. And what is the vestibular bulb? Bartholin ducts क्या? Two Bartholin glands on each side, pea-sized and yellowish white in color, situated in the superficial perineal pouch close to the posterior end of the vestibular bulb. These are the vestibular bulb. Let's talk about perineum. Perineum is the area extended from the foresheet to the anal canal, roughly triangular and consists of the connective tissue muscle and the fat. Let's talk about perineal tear. During labor, it become thin, perineum become thin and stretch, making it liable to the tear. Third degree tear, first degree tear, second degree tear, third degree tear, and fourth degree tear. In first degree type of injury, ओनली द फोर शीट इज टॉट। फोर शीट जो है उस पे टेयर आता है, उस पे कट आता है। सेकेंड डिग्री टेयर, इन दिस टेयर the tear extend beyond the foresheet but does not involve the rectum or the anus. And third degree tear, the tear involve the internal sphincter or the rectum. Let's talk about the blood supply of the vulva. The oxygenated blood is derived from the internal pudendal artery and superficial external pudendal artery. These are two arteries that mainly supply the oxygenated blood to vulva. Deoxygenated blood is mainly discharged into the internal pudendal vein, and the lymphatic supply, it follow the course of the veins just like internal pudendal nerve.